In this DVD, you'll find what you need to know to get started. You can also find all of this information, plus a few extra details, in your welcome booklet. And of course, you must talk to your doctor or MS nurse if you have any further questions. With relapsing remitting multiple sclerosis, or RRMS, symptoms can sometimes flare up in relapses, which can be unpredictable. This video will review what causes these symptoms and how this treatment works. In people without MS, immune cells attack viruses and bacteria, but they don't harm the body's own cells. In people with MS, however, some immune cells, particularly a type called lymphocytes, start to attack the body's own nerve cells in the brain and spinal cord. Nerve cells are responsible for transmitting signals that coordinate different body functions. They have a long fiber, the axon, which is covered in a fatty coating called myelin. This helps to protect the axon and allows for efficient signaling. It is this myelin that becomes damaged by antibodies that are released from immune cells. This slows down the signaling, which is what causes MS symptoms. Sometimes the symptoms can regress completely. This is why you can often experience temporary relief from relapses. In some cases, immune cells can damage the axon underneath, breaking it and preventing signaling altogether. This cannot be repaired and may well explain persistent or worsening MS symptoms. All in all, areas of the brain are left damaged and inflamed. These areas are known as MS lesions. Movectro works by targeting specific lymphocytes, reducing their numbers in the body. This is believed to help reduce the damage they might otherwise cause. In fact, movectro treatment has been shown to reduce the formation of new MS lesions. So taking movectro can help to slow down your disability progression and give you more time between relapses, which means you can spend less time on your MS and more time doing the things that you want to do. To do anything well, it always helps to have a few clear instructions to follow. You'll find the exact dates you need to take your tablets in your personal treatment summary. In general, you'll take your tablets for 1 week and then again 4 weeks later, and that will be all for the next 10 months. The number of tablets you need to take on each day of each course is shown on your treatment summary and on your tablet holder. Just double check that these match. If not, please get in touch with your doctor before you start your course. If you miss a dose and remember on the same day, take it right away and carry on as normal. If you don't remember until the next day, take it then, and extend the treatment days to finish your tablets. Do the same if you miss 2 consecutive doses. If you lose a tablet, contact your pharmacist for a replacement tablet. If you accidentally take too many tablets, please contact your doctor immediately. Have a glass of water ready and make sure your hands are clean and dry before taking your tablets. Turn the tablet holder over to check which day's tablet you need to take. Pick up the tablet holder in your left hand so that the center button is facing you and is visible. Pull the center button back with your right thumb and hold it there. Squeeze the buttons on the sides of the holder with your left index finger and thumb and keep them squeezed. You can now release the center button. Pull the tablet tray out with your right hand. You can now stop squeezing the buttons on the sides. Push 1 or 2 tablets into your hand with your thumb as required. Put the tablet in your mouth and swallow it with water. Don't chew it or let it dissolve. Try not to touch your nose, eyes or other parts of your body. Put the tablet holder tray back in until it locks and wash your hands with soap and water. Do not store the tablets in a different container. Always keep them in the tablet holder until you're due to take them, and store the holder somewhere out of the sight and reach of children. Do not take your tablets at the same time as any other medicine. You should take your tablets at least 3 hours before or after taking any other oral medications. And it's best if you take them at roughly the same time each day. This can be any time of day. It doesn't matter whether it's before or after a meal. Whoever's meal, that is. As with many things in life, when you're starting a new treatment, you want to get as much information as you can about what to expect, so you don't get caught unawares. Before every course, your doctor will give you a pregnancy test. Well, maybe not everyone. You'll also get a blood test. This might be used to test for tuberculosis, hepatitis or shingles, and to check that your immune cells are at the expected levels. You'll also need a blood test 1 month after the second course of tablets, and then regularly in the treatment-free period to check the levels of your immune cells. There are certain things to avoid while you're taking movectro. These include breastfeeding and getting pregnant, or getting your partner pregnant. If you're going on holiday, there are certain vaccinations you should avoid within a period of 3 months after taking your second course of tablets. So please speak to your nurse if this applies to you. Like all medicines, movectro can cause side effects, although not everyone will get them. Common side effects include lymphopenia. This is when your lymphocytes are greatly reduced. Rashes, hair loss, and irregular menstrual bleeding. You might also be more prone to colds, ear, nose, and throat infections, headaches, dizziness, and ringing in the ears. Consult the product leaflet for a complete list of side effects, and if you notice a side effect not listed in the leaflet, or if you are worried about any side effects, please talk to your doctor. Although movectro reduces the frequency of relapses, you may still experience them from time to time. Even if you do have a relapse or experience a new or worsening symptom, please don't lose heart. It's important to speak to your doctor about any concerns. He can prescribe a short course of corticosteroids to help speed up your recovery. If you have any further questions on how to use this product, ask your doctor or pharmacist. By knowing what to expect, you're better placed to anticipate anything that's coming your way. Sometimes it can seem hard to find the information you need, so we've made it as simple as possible. You've already received your welcome kit, which contains a welcome booklet and DVD, and you'll have been given a treatment summary by your doctor, which contains your personalized treatment schedule. On there, you'll also find your login to the movectro website, where there is plenty of support and useful treatment tools. Plus, of course, there is the number for our dedicated support line, staffed by trained nurses 365 days a year. All of which will help you get the answers you need, however you prefer, so you can spend less time worrying about MS and more time getting on with life.